Should I use ice or heat? Hi, Dr. Malka here, your chiropractor and acupuncturist practicing in Los Angeles, California, and I get this question all the time. If you have any underlying conditions, please give your physician a ring before you do any recommendations I'm about to give you. Everyone wants to use heat because it feels so good. And when you have a recent injury, let's say within the last 2 days, it may feel good while the heat's on, but when you take the heat off, it can feel a lot worse. That's because with an acute injury, there's a lot of inflammation and swelling, and heat will make the inflammation and swelling worse. So you want to cool it down because inflammation causes swelling in the area, and that pressure causes pain, and the cold reduces that swelling and pressure. The first thing to do when you get injured is to immediately apply that ice pack. Also apply an ice pack after stretching or exercising when you have an injured muscle. In nature, inflammation attracts scar tissue, which will act like a splint to protect the area, which is helpful when you can't rest the area, but scar tissue can cause long-term stiffness. And in our modern world, when we can rest, the ice can help to avoid that. Also, after therapy, I always recommend that my patients apply ice every hour for 20 minutes, 3 to 5 times a day, regardless if the injury is new or old, because my therapy, especially my deep tissue therapy, can cause temporary inflammation. It's like cleaning out an old garage. Sometimes it looks worse before it gets better. Ice is not good for people with poor circulation, so once again, consult your physician. If you don't have an ice pack, a bag of frozen veggies like peas work great. Take that opportunity to defrost your dinner. You can also use a wet towel, put it in a Ziploc bag, and freeze it. And if you're traveling, bring some Ziploc bags along, get some ice from the hotel vending machine, and just fill it up and pack it on. If you want to get fancy, you can make your own gel pack. Simply get a large Ziploc bag, add 2 cups of water to 1 cup of 70% alcohol, make sure the air is out, zip it up and put it in the freezer. When applying ice, make sure you have a barrier, like a towel or a pillowcase on top of your clothing. If you're dealing with an ankle or wrist injury, you can use your sink or get a pot and put a combination of ice and water and soak the area for 20 minutes every hour, about 3 to 5 times. A combination of heat and ice can be helpful for chronic injuries by warming up those muscles before you're stretching or exercising them, and then applying ice afterwards. Or if you're at rest, put heat first, followed by ice, and then keep repeating this, and it'll create kind of a pumping action for blood flow. In general, hot therapy is used to increase circulation of the blood flow. So it's good before stretches and exercises to loosen up those muscles and keep them warm to prevent injury. It doesn't have to be scorching hot, just warm. If you have an old injury of a muscle, let's say a calf muscle, put a hot pack on it before exercise and make sure you have some nice thick socks and some warm sweatpants to keep that area warm during your workout. So if it's cold outside, bundle up those muscles before you start exercising. For instance, I hike, so I make sure to wear really warm, nice, thick sweatpants because hiking is mainly a lower body workout. And if I feel like I might get a little too hot, I'll wear some light clothing up on top. If my patients wake up with stiffness in their hands from arthritis, I recommend soaking their hands in warm water and moving them around until the stiffness goes away. And then they'll feel a little more comfortable that way. Or they can wrap their hands in a warm towel. You can get creative and make your own hot pack by putting rice in a sock and putting it in the microwave for 1 to 2 minutes or so. Make sure you put a knot on top of that sock so it stays nice and sturdy and the rice doesn't spill around. And once again, I cannot emphasize enough, consult your physician because with some conditions like dermatitis, vascular disease, or diabetes, heat is not recommended. So if you have any questions about using hot or cold, put them in the comment section below and I'll address them. And make sure if you haven't yet to subscribe. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.